Cruciate ligament tear. Definition: The anterior cruciate ligament is one of pari and cruciate ligaments in the human quint. The purpose of the ACL is to prevent anterior movement of the tibia of the femur, as well as inversion of the quint.
An ACL tear can be a serious sports injury. Patients often require invasive surgery and face a high risk of arthritis developing in the injured knee within 20 years of surgery. Because the ACL is different from other ligaments which can heal on their own, the current treatment is ACL reconstruction. A surgeon must remove the torn ACL and replace it with a tendon graft. ACL reconstruction is a good option for many patients, but if the ACL could repair itself, patients wouldn't have to also recover from having a graft taken. At Boston Children's Hospital, Dr. Martha Murray and her team may have found the answer. Bridge-enhanced ACL repair is a game-changing new procedure that stimulates a torn ACL to heal itself, eliminating the need for a tendon graft. First, the surgeon places sutures to stabilize the ACL and the knee. A sponge made of special proteins is placed into the gap between the ends of the ACL, providing a bridge for the ligament to grow into. After the bridge is in place, blood is drawn from the patient. This is added to the sponge, creating an environment for a clot to form, jump-starting the healing process. The surgeon then uses the sutures to pull the torn ends of the ACL into the sponge. Over the next 6 to 8 weeks, the ends of the torn ACL grow into the sponge. They reconnect, and the healing tissue replaces the sponge. Early clinical trial results from this innovative procedure suggest the repaired ACL may work as well as one reconstructed with a graft. Researchers hope bridge-enhanced ACL repair will decrease the time it takes to regain strength after ACL surgery and possibly reduce the long-term risk of arthritis in the injured knee.
Application in medicine. ACL reconstruction and surgery treatment where the original ACL is removed and replaced by graft. My different grades increasing BTB or grades EZ. I don't know, 116 5 2 10.
ACL stands for anterior cruciate ligament. It helps our knees move. When the ACL is torn, the knee becomes less stable. Some tears are minor or partial. Others are full or complete. ACL tears are common among football, basketball, and soccer players, and skiers. That's because these sports involve stop-and-go movements, usually caused by a sudden twisting motion. There's often a loud pop, severe swelling, and extreme pain when you move the joint. Sometimes, it's even impossible to walk. The best time to diagnose an ACL tear is within the first hour after injury, before the knee swells. The doctor will ask you questions, evaluate your knee, and send you for x-rays or an MRI to confirm that your ACL is torn. UPMC experts have also developed pivot technology to determine a knee stability profile for every patient. What's the treatment? For minor tears, protective braces and physical therapy can strengthen the muscles around the knee and restore range of motion. But a full tear will not heal on its own, requiring reconstructive surgery to rebuild the ligament. Because ACL reconstruction requires an individualized approach, it's important to choose an orthopedic surgeon who specializes in ACL surgery. Brought to you by the specialists at UPMC Orthopedic.
Using a plane in Ecuador. Sigillary therapy patients consider the instability to be severe and most commonly by modified their activities. Mild or moderate pain was reported to be 61% of patients usually relating to stronums or violence exercise. She will occur occasionally in 14% of patients.
Hi, I'm Bob Trump, physical therapist.
Brad Haney, physical therapist.
And together we are the most famous physical therapists on the internet.
Well, in our opinion, of course, Bob.
Brad, today we're going to talk about top 3 signs that you may have an ACL tear.
ACL.
Yeah.
Okay.
One of the ligaments of the knee, one of the 4 major ligaments of the knee, and it's usually a terrible injury. It's usually one that's going to end your season in your sport.
Right.
And let's first talk about what it is. We've got where's the other rest of the leg?
Oh,
Get rid of it.
Here it is.
So anyway, you got the femur bone here.
Oh, we lost
You
the
throw in
patella.
We got the femur, and we got the tibia. Now these 2 bones come together, and
Let's get the patella on there.
that's the kneecap.
We'll
These 2
pull that
bones
off.
come together, and they're held together by 4 main ligaments.
Right.
And one of them is the ACL, and that ACL is right in here. And basically the ACL stops this bone here from going forward like this.
They call that anterior translation, but in other words, just keeps that from moving forward.
So if that ligament tears, you can see how you're going to be unstable. And I'm going to show you on another model here. Here again, this is the femur bone cut off, this is the tibia bone cut off, and
Let's show them on a person.
all right, let's show on a person. Okay, now we have a real knee here. And again, what you would want to do first is, if this is the injured knee, I would actually do the same test over here first. And that gives you a sense of what a normal movement would be. And then when you compare it to the other side, you can tell the difference whether or not there actually is a ligament tear. And first off, this is going to be very difficult to do on someone who just injured it. It may be even spasming. You probably got to ice for a while, let it calm down.
Right.
I mean, they have to be relaxed for this to work.
Right.
So you can't be doing this on someone who's just probably injured it 2 minutes ago.
Right.
All right, so again, the Lockman's test, you're going to first put it at around 20 to 30 degree angle. I'm going to secure the femur. I actually would normally grab here, but I'm going to grab here just so you can see. I'm going to secure the femur, hold it, the upper bone, and then I'm just going to go ahead and grab the tibia here, and I'm going to pull forward like this. And Brad, I'm glad to tell you that you're a little bit of movement on Brad's. So that's why we do both tests. You can see I'm really pulling forward. Again, as you saw on the skeleton, I was pulling it this way. If there's really a big difference between the one side and the other, there's a chance you may have tore your ACL. You may have tore some other things along with it too.
Sure.
Because quite often the ACL doesn't get torn alone. All right, Brad, that should do it.
Yeah, and this is, you can try it at home, but it is one of those things that takes some repetition to get good at it, I think. But, if it's really tore, like Bob and I were talking, if it's a big difference, and if it hurts.
Pros and cons. Pros: years to enter to can't greater can't stability. Cons and can leading to inflammation, anterior pain, pain to one killing, a panelin tendon calling B2 narrow. Conclusion: intake and it is up to the pattern and the doctor to consider the pros and cons of it. Craft and decided what were result in the best possible lifestyle for what the patient would like to be able to age after surgery.
Immersion Media, next generation training and instructional media. Years ago, a torn ACL was a career-ending injury for an elite athlete. With advances in technology, surgical procedures, and rehabilitation, however, An elite athlete now has an excellent chance of returning to high-quality sports participation. To keep the joint stable, a set of 4 ligaments keeps the knee in a hinge-like position while you move. 2 ligaments on either side of your knee joint, the medial and lateral collateral ligaments, connect to either side of your femur and tibia and limit shifting movement left or right. The other 2 ligaments, the anterior and posterior cruciate ligaments, connect from the base of your femur to the top of your tibia. They cross each other and prevent the knee from excessive forward and backward movement, as well as twisting movement in either direction. If a movement is forceful enough, any of these ligaments may snap, including the ACL. Once torn, the ACL cannot regenerate or repair itself. The ACL reconstruction operation is now typically a 1-hour outpatient procedure, performed successfully more than one way. We'll examine one of the more common methods used in ACL reconstruction. The entire surgery is completed through just a few tiny incisions. One is made for the insertion of a tiny camera and to deliver fluid to establish a clear view of your joint. 1 or 2 additional incisions are made on either side of your kneecap to give the surgeon access to your joint. 1 very small incision is made to anchor the new grafted ACL in place. To start the procedure, the surgeon will insert a probe to inspect the damaged joint. A small motorized shaver will then be used to remove the damaged ACL